COVID-19 vaccine necessary to save lives now. In the longer run, especially if COVID stays with us for years, we need a more geographically diversified global vaccine manufacturing base. And it is really heartening to me to hear so many leaders speak of this today and speak of their willingness to support this. Having less than 0.2% of manufacturing capacity in Africa is not a recipe for supply resilience. International organizations can facilitate cooperation and investment here as well. And the WTO will work with the WHO, Gavi, and CEPI on the COVAX Vaccine Manufacturing Task Force to improve equitable access. And finally, we must address issues related to technology transfer, know-how, and intellectual property, including the TRIPS waiver proposal. Let me thank all the leaders who have spoken today in support of the ongoing discussions at the TRIPS Council of the WTO. I'd like to thank them for their willingness to move this along, because we must act now to get all ambassadors to the table to negotiate a text. This is the only way we can move forward quickly. We can't move forward with speeches and polemics. We have to sit down and negotiate if we want to save lives. I'm hopeful that by July, we can make progress on a text, and by our 12th ministerial conference in December, WTO members can agree on a pragmatic framework that offers developing countries near automaticity in access to health technologies, whilst also preserving incentives for research and innovation. In closing, I invite you to imagine how the next crisis could look if we adhere to the principles set out in the Rome Declaration. We would have invested the billions in surveillance and health systems that can save trillions in economic support and forgone output. We would have catalyzed the innovation we need while ensuring equitable access for people in poorer countries. A successor to Act A would not face an $18.5 billion funding gap, despite immense returns on investment. Meetings like this one might be less urgently required. And as happy as I am to see everyone today, this is a scenario we really need to make worth turning into a reality. Thank you.
Thank you, Director General. I'm very much looking forward to working with you in our efforts to promote vaccine equity by enabling open supply chains, by scaling up manufacturing efforts through the best use of intellectual property and knowledge transfer. Let me now turn to President Tshisekedi of the Democratic Republic of Congo and President of the African Union. President, the floor is yours.
Madame la Présidente de la Commission de l'Union européenne, Monsieur le Président du Conseil des ministres de la République d'Italie, je voudrais avant toute chose vous remercier en tant que co-organisateur de cette importante réunion internationale qui se focalise aujourd'hui sur la COVID-19. Excellences, Mesdames et Messieurs, les chefs d'État et de gouvernement, Mesdames et Messieurs, l'Afrique, tout comme l'ensemble des continents, est touchée par la pandémie à COVID-19. Les souffrances que cette dernière cause à la planète tout entière, souffrances encore bien palpables en ce jour, justifient ces assises. En effet, les dégâts provoqués par cette pandémie sont énormes en termes d'incapacité et de pertes en vies humaines. Outre l'aspect purement sanitaire, les conséquences de la pandémie à COVID-19 continuent de représenter une menace pour la stagnation ainsi que la fragilisation des économies. Et ce, même pour les économies les plus performantes de la planète. Au regard des conséquences infiniment désastreuses causées par cette pandémie, notamment en ce qui a trait à son impact sur le développement de nos sociétés et les pertes économiques y engendrées, nous pensons que l'Afrique autant que le reste du monde, se devrait de saisir l'opportunité qui s'offre ici d'analyser et de pallier comme un seul homme aux dysfonctionnements qui nous ont menés à ces atermoiements. Un tel exercice s'entrevoit comme l'une des seules conditions de possibilité de mise en œuvre par la communauté internationale de réactions calibrées en prévision d'éventuelles pandémies futures. Il nous semble par ailleurs important d'insister sur le fait que, pour les pays à revenus limités, la lutte contre les pandémies futures rappelle la nécessité de la construction de systèmes nationaux de santé pour qu'ils soient efficaces et résilients afin de couvrir les besoins essentiels de protection d'un plus grand nombre de nos concitoyens. C'est le sens que nous accordons à l'accélération des progrès vers la couverture santé universelle. Celle-ci aiderait la mise en place de systèmes de santé qui soient à même de répondre aux épidémies, aux urgences ainsi qu'aux catastrophes sanitaires ultérieures. Le renforcement de ces systèmes de santé nécessite une coopération internationale qui appelle la solidarité de tous. Ces systèmes de santé devront intégrer les avancées technologiques les plus récentes en plaçant l'humain au centre en vue de garantir des réponses efficaces et efficientes aux situations futures. Excellences, Mesdames et Messieurs, lors de la réunion virtuelle des ministres africains de la Santé qui s'est tenue ce 8 mai 2021, une stratégie continentale de lutte contre la pandémie de Covid-19 a été adoptée. Il m'importe d'en mentionner ici les points essentiels, à savoir la nécessité d'élargir la capacité de production des outils de diagnostic, des médicaments, des vaccins ainsi que des équipements essentiels pour la santé. L'importance de la proposition américaine de soutenir l'OMC dans le but de lever la restriction au brevet sur le vaccin, levée de restrictions qui augmentera la disponibilité des vaccins au bénéfice de nos populations. La nécessité d'une version adaptée de la stratégie continentale commune qui mette l'accent sur le renforcement de la prévention, du suivi et du traitement dans le but de faire face avec plus d'efficacité aux mutations du virus de la COVID-19 sur le continent, ainsi qu'aux fluctuations inhérentes à la nature de cette pandémie à l'échelle mondiale. La nécessité de soutenir la poursuite de la collaboration entre le CDC Afrique, l'OMS et les autres partenaires en vue d'augmenter la capacité de préparation et de riposte contre la pandémie sur le continent africain. Excellences, Mesdames et Messieurs, nous ne pouvons pas faire face aux défis de la pandémie actuelle sans unir nos efforts et mettre en commun nos savoirs. Au nom de mon pays, ainsi qu'au nom du Bureau des chefs d'État de l'Union africaine, je remercie à nouveau la présidence italienne du G20 et la Commission de l'Union européenne, ainsi que tous ceux qui ont contribué depuis des mois à la rédaction de la déclaration qui nous est proposée. Nous souscrivons donc pleinement aux principes qui sont énoncés dans cette déclaration et appelons de tous nos vœux à ce que ces principes se traduisent par des actions concrètes qui puissent contribuer à vaincre la pandémie actuelle et à nous prémunir contre les dangers que représenteraient les épidémies futures. Je vous remercie.
Merci beaucoup, Monsieur le Président. And let me turn now to the CEO of CEPI, Richard Hatchett. You have the floor.
And Prime Minister Draghi, thank you for organizing this important summit and for investing in pandemic vaccine innovation through CEPI. Excellencies, distinguished colleagues, friends, I'm honored to join you here today as an ACT Accelerator partner and co-founder of COVAX, and feel privileged to share insights gleaned from 17 months of hard struggle against SARS-CoV-2. Sadly, despite decades of warning and effort, despite an accelerating cycle of global infectious disease crises, and because a series of small steps were taken over many years when large ones were required, we were not prepared to respond when the pandemic we all feared suddenly materialized. And we are staring at the consequences. Already more than 165 million confirmed cases, more than 3.4 million confirmed deaths. We know that these counts are incomplete. Independent reckonings of excess deaths estimate that the true toll has been far higher, between 7 and 13 million deaths. Walter Benjamin, in his theses on the philosophy of history, observes that the tradition of the oppressed teaches us that the state of emergency in which we live is not the exception, but the rule. For a year, we in high-income countries have lived with the rest of the world in a state of emergency that now, with the gifts bestowed by science, at least for some, seems to be lifting. But as our lives return to normal, we are leaving billions of people behind in a state of emergency and deprivation that is sadly all too familiar and enduring. We today again express our solidarity and enumerate steps meant to remedy the inequity that stains the global response. We must forgive our brothers and sisters in poor countries if they remain skeptical until they too feel the state of emergency begin to lift. A century ago, as the world emerged from World War I and the great pandemic, said, our present need is not heroics, but healing, not nostrums, but normalcy, not revolution, but restoration. The first would have been to extend early, at-risk public sector financing to support the expansion of manufacturing capacity and the execution of advanced purchase agreements on behalf of a global access facility, of COVAX. The second would have been for countries that invested in vaccine development in the interest of their own populations to have included in their grant and contract agreements global access requirements covering some portion, perhaps 50%, of the output produced after domestic requirements were met. And there are three we must commit to if we are to prevent such crises in the future. We must make collective, coordinated investments to compress medical countermeasure development timelines to 100 days or less. The UK is eligible for the G20 to embrace this goal as well. We must also substantially broaden the number of viral threats covered by vaccines developed on rapid response platforms through coordinated research and development programs. And finally, we must achieve a more equitably distributed and networked global vaccine manufacturing capability for their own health security. Joint commitment to these 5 goals would greatly enhance our collective security. The Rome Declaration is a wonderful statement of intent. Such commitment could be expressed in a binding way in the Pandemic Preparedness Treaty for which so many of you have expressed support. I and my colleagues in COVAX and the ACT Accelerator stand ready to work with you all for a better future. Thank you.
Thank you, Richard. CPI was a founding member of ACT-A and must take an enormous amount of credit. It promoted vaccine equity, and I welcome your comments in relation to manufacturing, anticipating future pathogens, and the importance of sustained financing for R&D. Let me now turn to our next speaker, Prime Minister Solberg of Norway. Prime Minister, the floor is yours.
Thank you. Health security is a global public good. It's also a social and economic security issue. And health is an essential component of the Sustainable Development Goals. So we must all work together at both the global, regional, and national levels, with governments, UN organizations, and civil society, and with the private sector. CEPI and Gavi are examples of successful public-private partnership. The World Health Organization plays a central coordinating role at the international level. We need to make it possible for the World Health Organization to deliver on its mandate. It must be given operational independence, and it needs to be fully financed. We are prepared to increase our assessed contributions considerably. We need to cooperate across sectors and strengthen coordination of One Health implementation. And we must seize the opportunity to change the course of this pandemic and to be better prepared in the future. We must invest in prevention and in preparedness, in robust health systems and universal health coverage, in research and development, and in diversified manufacturing capacity and technology transfer. When a crisis emerges, the resources must already be available. Financing pandemic preparedness is an investment, and we have been reminded that the investment is small compared to the cost of inaction. Investment in pandemic preparedness is a global public good, which will benefit all countries. We should finance pandemic preparedness collectively based on a system for fair burden sharing. International health regulations and enhance global cooperation in new ways. We believe that a pandemic treaty could establishment of a new global financing mechanism. It will provide predictable funding to different implementers. The world has developed safe and effective vaccines faster than ever before. Now we must ensure universal access. And I'm proud to serve as co-chair of the ACT Accelerator Facilitation Council, together with President Ramaphosa of South Africa. ACT-A is a unique multilateral collaboration designed to increase global access to tests, treatments, and vaccines. And Norway is helping to share the burden. We have contributed $500 million to ACT-A. In addition, we will share surplus vaccines. Our current estimate is 5 million vaccine doses, 1 per capita in Norway. The world also needs to produce more vaccines and to ensure their use. And I'm pleased that Germany and South Africa will co-chair a high-level ACT-A and G20 working group to this effect. This high-level working group will be able to deliver on the request from the Secretary General Guterres for a G20 task force. And I call on all of you to do your part and contribute your fair share to ACT-A, because no one is safe until everyone is safe. Thank you.
Thank you very much, Erna Solberg. Thank you also for pledging additional vaccine doses in kind. Thank you very much for that. Now we have the pleasure to turn to Prime Minister António Costa of Portugal, also the rotating presidency of the European Union. António, you have the floor.
Thank you, dear Ursula, caro Mario. In this Global Health Summit, we are called upon to prepare the future while still combating the current pandemic. The Portuguese presidency of the European Union Council coincided with some of the worst phases of the pandemic, but also with the vaccination rollout and the start of the recovery. Scientific international cooperation allowed us to develop and produce vaccines in record time. We must now focus on promoting widespread access to vaccines by expanding manufacturing capacities, preventing supply chain bottlenecks, and removing export restrictions. That is why we should not be distracted from our immediate needs. Speed up manufacturing and distribution of vaccines to all, guaranteeing immunization as a global public good. The European Union is doing its part. It leads in supporting research and development of vaccines and in financing their production and distribution. The European Union and its member states are among the lead contributors to COVAX, and the EU is setting up a European vaccine sharing mechanism directed to partner countries. Second, we must deal with the social and economic consequences of the pandemic. We must shore up the recovery on new foundations, making the best use of trends and technologies already in progress before the pandemic, the green transition and the digital transformation. In this endeavor, we must give special attention to those more vulnerable to the crisis and to the ongoing transformations in the economies and labor markets. This week, in the summit on financing African economies, which took place in Paris, we consolidate a consensus on the need of a new issuance of special drawing rights of $650 billion, 30 billion of which will go to African countries. Only with adequate financing countries, especially the most vulnerable countries, will be able to fight the pandemic and foster recovery. We universal access to vaccines should be attained, including via production in Africa. Third, the world needs to be better prepared to prevent future health crises. At the multilateral level, we must support, strengthen, and reform the World Health Organization and promote the full implementation of international health regulations. Portugal is also willing to participate on the negotiation of an international treaty on pandemics. Within the scope of the WHO and having an international health regulation as its cornerstone. The One Health approach must also be at the center of our discussions. The impact of the effects of climate change in vector-borne diseases should be a top priority, as well as the challenges posed by antimicrobial resistance. The pandemic took us by surprise, but in the past year, we have been learning from our response to it. We learned that it is better to combat the pandemic together than in isolation. That vaccine nationalism, trade barriers, and supply chain bottlenecks will only make us all worse off. That our national health services and their workers are the first and best line of defense against the current and future crises. The Rome Declaration offers us a valuable guidance, and I thank all countries and organizations, as well as the scientific panel and civil society, for their contributions to the debate, helping us to be better prepared for our post-pandemic future. Thank you very much, and thanks especially to Mario to host this major event. Grazie mille.
Grazie, grazie.
Prego.
Thank you very much, Antonio. I really welcomed your remarks in relation to expanding vaccine coverage, to the importance of speeding up manufacturing. Let me now turn to the CEO of Gavi, the Vaccine Alliance, Seth Berkley. The floor is yours.
Excellencies and distinguished guests, it's a pleasure joining you here today. I'd like to thank Prime Minister Draghi and President Van der Leyen to speak. Almost exactly 1 year ago, before we knew if any vaccines would work, G20 leaders came together in support of the principle of rapid, fair, and equitable access to COVID-19 vaccines through the creation of COVAX, the vaccine pillar of Act A. We knew at that time this would be tough. But this did lead to the unprecedented act of global solidarity from now 193 economies, representing 90% of the world's population. A unique global solution built on the belief that one's ability to pay should not determine whether or not they are protected from COVID-19. Because during a pandemic, Today, under the leadership of Gavi, CEPI, WHO, and UNICEF, COVAX has delivered nearly 70 million doses to people in 125 countries, the first of over 2 billion doses secured for 2021. But as you've heard, there are dramatic and unacceptable inequalities in coverage. We must deliver faster. Of the 2 billion doses, we're on track to deliver 1.3 billion to the people in the 92 lower income countries later this year that otherwise would have little or no access through the Gavi COVAX Advanced Market Commitment, or AMC. By ensuring frontline health and social workers and vulnerable people are protected in all corners of the world, COVAX can play a pivotal role in stopping the spread of COVID-19. With additional support, we can not only reach more people, but can get there sooner. G20 countries can make this happen. By renewing your support of the COVAX AMC, you can help it bridge a critical funding gap. We already have $6.6 billion pledged, but in April at the One World Protected Summit hosted by the U.S. government, we launched a campaign to raise an additional $2 billion to pay for additional doses. If we can raise this by the time the world leaders will meet again on the 2nd of June at the AMC Summit, hosted by Prime Minister Suga in Japan, COVAX can increase the total number of secured doses for lower income countries to at least 1.8 billion doses. To protect close to 30% of the people in AMC countries, potentially preventing up to 800,000 deaths. Furthermore, it'll enable us to slow down the circulation of the virus, which not only reduces the risk of new and potentially more dangerous variants emerging, but will ultimately help us end the acute phase of the pandemic by the beginning of next year. However, in addition to dollars, COVAX also needs doses now. Like many countries, it has been affected by the current vaccine supply constraints, as many of you have mentioned. Because of this, we urgently need G20 countries to share doses, initially at least 20 million of them this quarter, to make up for the shortfall resulting from supply delays triggered by the surge of cases in India. There are now 20 million people in lower-income countries who have received their first dose, but are now at risk of not being fully protected because they may not receive their second dose in time. G20 nations are in a position to prevent this, and in the longer term, increase vaccine coverage, which will be essential to stop transmission by following the lead of countries like France and other members of Team Europe announced today, and the US, and donating doses for equitable distribution through COVAX. The US $2 billion funding gap and the more than 20 million acute shortfall needs your urgent support. We have the systems in place. With your help, COVAX can deliver. This will be the largest and fastest vaccine rollout in history. Already, we're preparing for the very large number of doses that will be flowing to countries in the second half of the year, and we also need now to begin to prepare for 2022. We appreciate the global efforts to support COVAX throughout the year, and at this meeting, we look forward to seeing you at the forthcoming June 2nd AMC Summit. Thank you for your attention.
Thank you very much, Seth, for your strong call, rightly so, to donate more to COVAX and to enable COVAX and Gavi to do their important job. Now, I would like to turn to the President of Rwanda, Paul Kagame, mainly for the new partnership with Africa's development. President Kagame, you have the floor.
Excellencies, co-chairs, Mario Draghi, Prime Minister, President Ursula von der Leyen, Excellencies, heads of state and the government, distinguished ladies and gentlemen. I am pleased to join you for this Global Health Summit, happening when the COVID pandemic has all of us preoccupied by the health of our people and the well-being of our economies. The challenge also presents an opportunity to do things better and different. First, we have to urgently improve the frameworks and tools needed to defeat this pandemic and others that are sure to follow. Ending COVID-19 will require expanded pathways to vaccine access for populations throughout the world. The COVAX facility, along with African Union Vaccine Acquisition Tax Scheme and the African CDC, have helped to distribute millions of vaccine doses to our continent. But much more is needed for Africa to defeat the pandemic. In the context of developing hubs for manufacturing the vaccines in our continent, Rwanda is in advanced talks with private firms and multilateral agencies to build manufacturing capacity in our region for the raw materials to produce mRNA vaccines. I thank the European Union institutions for the strong commitment we have seen to working with Rwanda and Africa on this priority. I also thank President Ursula for your efforts to connect us with the right technical partners. On the issue of intellectual property and the discussions around this, I hope soon we could find an appropriate solution. Is the technology transfer cooperation on regulatory quality and training of Africa. Within the African Union, we are also working to establish the African Medicines Agency so that there are shared standards among our national regulators. The devastating impact of the COVID pandemic has demonstrated the indispensability of resilient national health systems built around universal healthcare. We appreciate the European Union's leadership on the need for a new pandemic preparedness treaty, which was first proposed by President Charles Michel. We welcome the expected launch of the negotiations process at the upcoming World Health Assembly. Closely related to this, the imperative to increase domestic for the African Union with the African Union Development Agency, NEPAD, providing technical advice. The Rome Declaration to be signed at the summit comprehensively covers the key priorities. Through the African Union Development Agency, NEPAD, we look forward to working with, including the World Health Organization, Gavi, CEPI, UNICEF, to improve outcomes and save lives on our continent. I thank you. For your kind attention.
Thank you, President Kagame. Let me now turn to Prime Minister Hsien Loong of Singapore. Prime Minister.
Thank you. Your Excellencies, Prime Minister Mario Draghi and President Ursula von der Leyen, thank you for convening this Global Health Summit, and Singapore is very honored to participate in it. COVID-19 has wreaked havoc on economies and people's lives everywhere. The world remains in the thick of the pandemic, but this will neither be the last nor the worst. Sooner or later, something more transmissible or lethal will emerge, and hence we must take every opportunity to learn from this pandemic, to prepare ahead. For the next one. Singapore fully supports the Rome Declaration of Principles to strengthen the global health architecture. The declaration lays out countries' individual commitments to fight COVID-19. A well-functioning public healthcare system is a critical part of any country's pandemic response. So we must strengthen our respective healthcare systems nationally and our capabilities, such as testing, contact tracing, and vaccination. Not just putting plans on paper, but also being able to execute them well. For example, organizing and carrying out vaccinations is a major administrative and organizational challenge, especially in places where populations are large and dispersed and the government's reach is limited. Such preparations should be sustained during peacetime to break the vicious cycle of panic and neglect. Beyond individual efforts, close international and multilateral cooperation is also essential. The repeated waves of COVID-19 clearly show that no country is safe in a pandemic until everyone else is safe. Even during difficult times, countries have cooperated to restore supply chains. Crucially, international scientific cooperation continued. Doctors and scientists shared information, studying the COVID-19 virus, developing treatments and testing vaccines. And this enabled us to improve treatments and produce effective vaccines in record time. Some overcoming global demands, a concerted The Independent Panel for Pandemic Preparedness and Response, the IPPR, has made several recommendations to strengthen the financing of the WHO so that it can continue to operate impartially. Singapore will also do our part to work with all countries to strengthen collective resilience against future pandemics. Singapore is happy to share our experience dealing with COVID-19 and in other areas like urban health emergency preparedness. I look forward to further discussions on taking the Rome Declaration further and to the recommendations of the G20 High-Level Independent Panel in July.
Thank you, Prime Minister. Thank you very much. Now let me turn to the Executive Director of the Global Fund, Peter Sands. Peter, you have the floor.
Thank you, President von der Leyen and Prime Minister Draghi and Your Excellencies. For the poorest and most vulnerable in the world, this pandemic has been and is an unfolding catastrophe. So our immediate priority must be to defeat COVID-19 as fast as possible, and not just in the wealthiest countries. The shocking figures for COVID-19 deaths that Tedros and Richard Hatchett cited tell only part of the story. The knock-on impact on HIV, TB, and malaria, on maternal and infant health, and on other conditions is immense and growing. In some of the poorest countries in the world, this knock-on impact will likely exceed the direct death toll. To defeat COVID-19, we must accelerate fair and equitable access to all the essential, but also diagnostics, therapeutics, oxygen, and PPE, so that countries aren't just flying blind, so that they can save the lives of those and so that they can protect the frontline health workers who put their lives on the line every day, and without whom none of the tools we're talking about can be deployed. Making this happen means fully funding the ACT Accelerator. If we had fully funded the ACT Accelerator 12 months ago, we would undoubtedly be in a much better position than we are now. If we don't do so now, we will undoubtedly regret it 12 months from now. As a founding member of the ACT Accelerator, the Global Fund is playing a leading role in supporting low and middle-income countries on all the non-vaccine elements of their responses, so testing, treatments, PPE, health and community systems. In doing so, we're leveraging the experience, infrastructure and capabilities used to fight the earlier and as yet undefeated pandemics of HIV, TB and malaria. The Global Fund was created precisely 20 years ago in response to the last big pandemic to strike humanity, HIV/AIDS. And this is a reminder, on the positive side, that the world can come together to act boldly in response to such. That as a global community, we have at best a mixed record on pandemics. We have left people behind, and we haven't always finished the job. Once people in the wealthiest nations feel safe, political momentum, scientific focus, and financial resources tend to slip away sharply. As a result, we've ended up with residual pandemics, disease. And that's what happened with HIV/AIDS, TB, and malaria. We cannot let this happen again with COVID-19. It's morally untenable, and it's bad epidemiology. With a mutating virus like COVID-19, no one is safe until everyone is safe isn't just rhetoric, but epidemiological fact. It's also not practical or cost-effective to draw a false distinction between and all pandemics. Most low and middle income countries' public health responses to COVID-19 were large HIV, TB, and malaria. Most low and middle income countries' preparedness against future threats will be based on what's being done now to fight COVID-19. As we strive to make the world safer for future infectious disease threats, way vulnerable from the deadliest infectious diseases. The earlier pandemics we haven't yet defeated, the pandemic we're facing right now, and future pandemic threats. And let's do so by making health systems stronger and more resilient, more inclusive, more people and community-centered, and more outcome-oriented, and better supported by finance ministry. And greater and more distributed manufacturing capacities. This is how together we can defeat COVID-19 and build an approach to pandemic simple and equitable, effective and sustainable. Thank you.
Thank you, Peter. Let me now turn to the President of Switzerland, Guy Parmelin. Guy, the floor is yours.
Thank you, Prime Minister Draghi, Madame la Présidente, Excellencies. First, let me thank our co-chairs for organizing this important summit. About 1 year ago, we came together at the pledging conference on the coronavirus global response. We were at the beginning of an extraordinary global cooperation with the launch of the ACT Accelerator. Since then, with the help of science and innovation, tremendous progress has been achieved. But new variants of the virus remain a great threat, and most of the socio-economic consequences of the virus are still ahead. The pandemic will not be over as long as all countries have not overcome it. Effective and adequate public health measures are required where the pandemic thrives, combined with the necessary mitigating socio-economic measures. Strengthened health systems are badly needed, and we must ensure access to safe and effective COVID-19 vaccines, diagnostic and medicines in all countries as soon as possible. Since the beginning of the crisis, Switzerland has been committed to finding global solutions for a rapid, affordable and equitable access to COVID-19 tools. Last year, Switzerland was among the early donors of the ACT Accelerator and other international organizations, especially in the humanitarian sector, to support the fight against the pandemic and its consequences. A few weeks ago, the Swiss Federal Council announced an additional contribution of more than 270 million euros dedicated to the ACT Accelerator. More than a third of this amount will support access to vaccines for lower-income countries through COVAX. In addition, last week, the Federal Council decided to explore the possibilities of providing 3 million doses of vaccines to COVAX. We also must think in the longer term. Globally, we need to scale up manufacturing capacities for vaccines. There are here no easy solutions. We have seen some very good partnerships with the private sector arising from voluntary licensing, enabling larger production while respecting the technological and safety requirements. We need to build on these experiences. On the other hand, we also must ensure that borders remain open to trade of these essential goods. In that regard, let me refer to the Trade and Health Initiative that is currently being discussed at the WTO. I wish to encourage all participants to consider positively this initiative as a way to strengthen our global and coordinated response to the pandemic. Looking forward, there are many lessons to be drawn from this crisis already now. Switzerland had put in place the measures foreseen by the international health regulations. But like others, we have been overwhelmed by the actual pandemic. We all can do better. Strengthening our health systems, promoting a One Health approach, and fully implementing the WHO. In this effort, we should be guided by a strengthened World Health Organization. Many new initiatives have been taken in the last months. It is important now to ensure that well-functioning governance mechanisms are in place to ensure accountability and transparency. We have established several evaluation processes and expert panels at global level. First recommendations will be discussed in the coming days. Building on this knowledge and with our political commitment, we can improve our preparedness and response to future health crises. Finally, I would like to thank all actors involved for their tremendous work in the fight against the pandemic. Switzerland will continue to participate in these international efforts in a spirit of solidarity, international collaboration, and multilateralism. Thank you very much.
Thank you very much, President Parmelin. And I have now the pleasure to turn to the Australian Minister of Health, Greg Hunt. Greg, you have the floor.
As Australia's Health Minister, I'm honoured to appear before you today on behalf of our Prime Minister, Scott Morrison, on behalf of the Australian Government and all Australian people. I particularly want to thank President Draghi and President von der Leyen for your leadership on this critical summit. We know that COVID-19 has taken a devastating toll around the world, and I express my deepest condolences to those who've suffered loss and hardship. And I particularly want to thank all of the health workers around the world, especially in Australia, who have tirelessly protected those at risk and those in need. We also know, though, that COVID-19 has delivered powerful lessons and highlighted the gaps and challenges in our global health system. At the same time, it has also created unprecedented multilateral cooperation through mechanisms such as the ACTA. In that context, the Independent Panel for Pandemic Preparedness and Response made many recommendations on strengthening the global health architecture so that it is fit for purpose. Australia recognises a strong, independent and authoritative WHO must be at the centre of any preparedness and response efforts. We urge all G20 member states to play their parts and ensure the WHO is robust, independent and able to fully carry out its operations on the ground. We need improved early warning systems to stop outbreaks at their source. We need stronger action to address antimicrobial resistance and to maintain open and resilient supply chains, especially for our medical goods. And we must always base our response on the best scientific evidence available. And above all else, we need coordinated support to protect those most at risk. The independent report also reinforced the importance of strong domestic action. In this regard, Australia is in a very fortunate position in the battle against COVID-19. Our response has followed a uniquely Australian path, striking balance between our health and economic objectives. We acted early on expert health and scientific advice to close our borders, and we've been able to substantially suppress the epidemic here through containment, capacity building and collaboration, with over 90 days of 0 cases of community transmission this year alone. Australia is also fundamentally committed to supporting others who need assistance, including our neighbours in PNG, Fiji and Timor-Leste, and across the South Pacific. We've committed more than $623 million over 3 years to help countries in the Pacific and Southeast Asia to obtain access to COVID-19 vaccines, and this complements our ongoing support to the COVAX AMC. Ultimately, strengthening health systems is the cornerstone of preventing future health crises. We welcome the powerful symbolism of G20 members and other nations coming to agree on principles and practical action to prevent future health crises. And we look forward to making this happen together, both through the G20 and through the 74th World Health Assembly next week. I thank you.
Thank you, Minister Hunt. Let me now turn to the Minister of Foreign Affairs for Brazil. Minister Franca, the floor is yours.
Thank you very much, President Mario Draghi, and thank you again, President Ursula von der Leyen. Ladies and gentlemen, it's an honor to represent the President of Brazil, Jair Bolsonaro, in the Global Health Summit. President Bolsonaro is since yesterday on a two-day field trip to the northern region of Brazil. And even though he could not be present due to scheduling reasons, President Bolsonaro assigned me to convey his message in close coordination with the Ministry of Health and to reiterate the importance of health diplomacy for Brazil. I congratulate the Italian G20 presidency and the European Union for the initiative of this high-level meeting. The objectives of overcoming the COVID-19 pandemic and building an international system that is more resilient to future pandemics require greater international cooperation and the strengthening of national health systems. The equitable access to vaccines, tests, and treatments, which we, G20 members, made a commitment to ensure to everyone, leaving no one behind. Unfortunately, it's not yet a reality. While some wealthier countries have plenty of vaccines and other resources to protect their populations, less developed countries are suffering the consequences of overwhelming pressure on healthcare and the lack of access to existing vaccines, supplies, tests, and treatments. In order to accelerate the vaccination process and the fight against coronavirus worldwide, Brazil defends the adoption of concrete measures to strengthen the international production of vaccines, medicines, and equipment in a greater number of developing countries, as well as the facilitation of health agreements, licensing, and transfer of technology. International cooperation and the participation of pharmaceutical companies will be essential to accomplish these goals. Brazil is negotiating technology transfer contracts with major pharmaceutical companies to manufacture vaccines in our public laboratories. While we recognize the flexibilities of the WTO TRIPS agreement, we are ready to enter into new partnerships with companies interested in producing in Brazil, benefiting from our health industrial facilities, skilled workforce, and experience in the development, production, and distribution of vaccines. We are also investing in expanding our production capacity with the construction of the Santa Cruz complex in Rio de Janeiro, which will be the largest biopharmaceutical center in Latin America. We are as well planning the future installation in Brazil of a laboratory with the highest level of biosafety available, NB4. Ladies and gentlemen, universal health coverage and a balanced approach to the relationship between human health, animal health, and the environment will be paramount to overcoming the pandemic. In Brazil, our Constitution guarantees universal access to healthcare. Our Unified Health System, or SUS, as we call it here in Brazil, is one of the largest free and universal public health systems in the world. Right now, Brazil still needs assistance. I would like to thank you publicly, once more, for the support we have received from friendly countries, especially donations of medicines for critical care patients. As far as vaccines are concerned, so far we have distributed almost 90 million doses and administered over 55 million doses of vaccines. With more vaccines in hand, we could considerably speed up this process to vaccinate up to 2.4 million people a day. Brazil commends the efforts carried out by the World Health Organization during the pandemic, not only to speed up development and scale up production of COVID-19 vaccines, therapeutics, and diagnostics, but also to make them accessible to everyone through mechanisms such as ACTA and COVAX. Through the COVAX facility, the government of President Jair Bolsonaro contracted 42.5 million vaccine doses for the Brazilian population. We are now studying the possibility of contributing to the other pillars of ACT Accelerator. As we understand the suffering caused by pandemic will only be alleviated when all countries have adequate tools to fight it. The government of President Jair Bolsonaro is proud of Brazilian legacy of international cooperation. Brazil intends to help other countries in their fight against COVID-19 as soon as possible, initially in South America, but also in Africa and other regions, through the donation of vaccines, diagnostics, tests, and treatments. By means of our health diplomacy, we are committed to doing our part to overcome the pandemic, not only in Brazil, but also around the world. Thank you very much.
Thank you very much, Minister. And now I have the pleasure to introduce the Minister of Health of Brunei for the Association for Southeast Asian Nations. Minister, you have the floor.
Co-chairs, distinguished delegates, ladies and gentlemen. The COVID-19 global pandemic has negatively affected the lives and well-being of people across the globe, including in the member states of ASEAN. On behalf of the government of Brunei Darussalam, I would like to express our absolute solidarity with individuals affected by the disease and affirm our commitment to work together toward effective response to the pandemic and post-COVID recovery. In responding to the pandemic, ASEAN has implemented various actions across its sectoral bodies within the health sector. This includes working towards the establishment of the ASEAN Center for Emergency Diseases. Reports on risk assessment for international dissemination of COVID-19 in the ASEAN region, exchanges on laboratory readiness and response, and risk communication in addressing false information. In addition to work within the health sector, the ASEAN response cut across disciplines through the ASEAN Comprehensive Recovery Framework, which articulates a collective ASEAN response through the different stages of recovery by focusing on key sectors and segments of society that are most affected by the pandemic, setting broad strategies and identifying measures for recovery in line with sectoral and regional priorities. We are pleased to share that ASEAN's team under Brunei Darussalam's chairmanship this year, We Care, We Prepare, We Prosper, aims to strengthen efforts towards recovery, resilience, and shared prosperity, and is very much relevant to the current situation. Brunei Darussalam is also pleased to report that our deliverables on health in ASEAN will focus on COVID-19 implications on mental health, as well as mental health among adolescents and young children. Even as we focus on the immediate challenges of COVID-19, we must not lose sight of our goal to leave no one behind. Measures taken to protect public health must ensure that all people, especially those at risk or infected by COVID-19, including women, children, the elderly, and the vulnerable group, can access essential healthcare services. Similarly, we emphasize the importance of ensuring affordable and equitable access to COVID-19 vaccines, which has been greatly hampered by the pandemic. Border restrictions and export bans have affected movements of commodities, including vaccines and other pharmaceutical and medical consumables. The global community must intensify the efforts to ensure equity in vaccine distribution by delivering vaccines, sharing vaccine technologies, and supporting the global scale of vaccine manufacturing efforts, particularly to those countries most in need, if we are to prevent unnecessary death and the emergence of new variants. To conclude, we affirm our commitment to work together to explore innovative solutions for COVID-19 response and recovery. Working synergistically, we can magnify our impact by using our relevance, scientific authority, expertise, and networks to engage with communities to set and implement a health agenda that improves the lives of all our people. Thank you.
Thank you, Minister. Now, let me turn now to the Minister of Health of Saudi Arabia and previous G20 President, Minister Al-Rabi'a. The floor is yours. Minister Al-Rabi'a, we don't hear you. Can you hear me? Minister Al-Rabi'a, can you hear me? The floor is yours. Minister Al-Rabiah, do you want to activate the microphone WebEx? Then I suggest we move on and then we'll ask Minister Al-Rabiah later. So you, okay, thanks, Ursula. Before our closing remarks of the GHS, Ursula and I discussed the possibility to recognize the key role that Act A has played and will continue playing in this current pandemic. For this reason, we have developed together with the Act A leadership a dedicated session within the Global Health Summit to celebrate it. President Ramaphosa of South Africa will open the session as co-chair of Act A. He will then be followed by a video focused on the key role of Act A. President Ramaphosa, please, the floor is yours.
Well, thank you very much, Prime Minister Draghi. And once again, I extend my greetings to all of you, Your Excellencies, and would like to thank you. Welcome to the ACT Accelerator segment of this Global Health Summit. It is indeed my privilege to be the co-chair of the Facilitation Council of the Access to COVID-19 Tools Accelerator, together with Prime Minister Solberg of Norway. While we have made quite good progress as the international community in battling this pandemic that engulfs the whole world, there are still substantial hurdles, including shortages of vaccines, oxygen supplies, and other life-saving interventions. The unequal distribution of vaccines, test kits, treatments, as well as personal protective equipment is widening the gulf between high and low-income countries. Since its establishment just over a year ago, the ACT Accelerator has facilitated access to diagnostics and therapeutics for COVID-19 for low and medium middle income countries. It is the most viable global mechanism that we have that can ensure equity of access. To maintain this good work, we need to step up our collective commitment through support to Act A and financial support for that matter, for the ACT Accelerator to implement its priorities for this year. We need to urgently mobilize approximately 18.5 billion US dollars. It is in our common interest that all countries are able to vaccinate their populations as quickly as possible, and that special support is given to low and middle income countries. In this regard, we appeal to all countries to support the proposal made to the World Trade Organization for a temporary waiver of the agreement on trade-related aspects of intellectual property rights. As I said earlier, this will facilitate increased production of vaccines in emerging economies. I'd like to believe that this is the time to deepen our collaboration to ensure equitable access to medicines. This matter does not need to be overstressed. It is there for everyone to see. And I'd like to say, what we need is the will amongst all of us so that we can move forward in the spirit of solidarity and partnership, which we have demonstrated more than we've ever done in the history of the world. This is now the time to do it when we come to vaccines. I'd like to thank you for your participation also in this segment. Thank you very much.
Thank you. Thank you.
COVID-19 has affected every country and person in the world. Its impact on lives and economies cannot be overstated. A year into a deadly pandemic, COVID-19 vaccines are protecting millions of people against the disease, but too many are missing out. By not extending tests, treatments and vaccination rapidly to every country, we're effectively choosing who lives and who dies. Since the ACT Accelerator was launched, $14.6 billion have been raised, thanks to the unprecedented mobilization of financing from around the globe. But we must do more. The ACT Accelerator needs $18.5 billion in 2021 to prevent further devastation in our most vulnerable countries. Using a formula that factors in national income, benefits from the resumption of trade, and income per capita, each country has been set a target contribution to ensure equitable investment alongside equitable distribution. Funding the ACT Accelerator fairly is not an act of charity. It's a global insurance policy to protect us all. The longer poorer countries go unprotected, the more the disease will spread, mutate, and threaten all countries. It's time for all high and upper middle income countries to step up by contributing their fair share.
That you will use it to continue to investigate the mysteries of the universe.